One good way to understand the important role that blood vessels play in your body is to look at what happens when blood pressure or blood resistance go out of whack, or what happens when blood vessels are damaged. And that's the topic of this last part of this lecture, starting with the idea of what circulatory shock is. Basically, the most basic definition that I can think of for circulatory shock is anytime you have oxygen levels become too low to sustain the metabolic demands of the body. So when oxygen levels are too low for the needs of the body, this is by definition what we call circulatory shock. There can be a number of different ways that we can develop circulatory shock, and I've divided these out into some general categories, starting with low venous return shock, and then we're going to talk about septic shock and anaphylactic shock, etc. So low venous return shock means that for one reason or another, the amount of blood returning to the heart via the venous network, by the venules and veins, is not enough to sustain the needs of the body. This can happen for a number of different reasons. One version is what's called cardiogenic shock. This means that something has happened to the heart and it is not adequately pumping blood so that it cannot get back to the heart. So if somebody has a myocardial infarct, this could produce cardiogenic shock. If somebody had sudden cardiac arrest, that would produce cardiogenic shock. Hypovolemic shock occurs when there's too little fluid in the blood. The blood volume has dropped, so the blood pressure drops. And as a result, again, we're not going to get enough blood circulating around the body to support metabolic demand. Sometimes we can have an obstruction in a vein. Let's say somebody gets a tumor growing and it starts to pinch off a vein like the inferior vena cava or something. Then you're going to get obstructive venous return shock. Last one, venous pooling, or what's called vascular shock, is a condition where you get too much blood accumulating in the limbs, particularly the legs, but it can happen in the arms too. And as a result, the blood is not returning to the heart as it should be. This can happen, for example, if somebody spends too long a period of time standing or sitting, or if somebody has widespread vasodilation. This can cause too little blood to return to the right atrium. It can also happen if something damages the medulla oblongata. This is called neurogenic shock. Think about it, if the medulla oblongata has that vasomotor control center that controls when arterioles dilate and when they constrict, if that area becomes damaged, the response is all the arterioles systemic wide just relax because they're not getting any more signals to contract. So you get systemic wide vasodilation and you can go into low venous return shock. Another type of circulatory shock is septic shock. Septic shock occurs usually as a result of some sort of a bacterial toxin. So an individual will become infected with a type of bacterium. That bacterium produces some toxic metabolic waste products that in and of themselves can trigger things like vasodilation systemic wide. And again, you're going to get low amounts of fluid returned. They also, in addition to triggering vasodilation, can increase the permeability of capillaries. So what happens is the capillaries become more permeable, more fluid leaks out of the capillaries, and that means blood volume drops really rapidly. If you want to see kind of a cascade of events that occurs in septic shock, this diagram here kind of shows you the lay of land and how you can get all the way to death if you don't get some medical attention. Another related type of shock is anaphylactic shock. Anaphylactic shock is usually due to some sort of a severe allergic reaction, wherein the mast cells, which are very similar to basophils, where the mast cells and eosinophils degranulate and release massive quantities of histamine. Histamine does two really important things. Histamine increases the rate of vasodilation. The other really important thing that histamine does is that it increases the permeability of the capillaries. Sound familiar? Should sound like what I just said happens in septic shock too. Okay, histamine, this is really important. You'll hear me say this again when we get to the immune system. Two key things histamine does: increase capillary permeability and induce vasodilation. Again, the problem with that is now I'm not getting enough fluid being returned to the heart, and I can go into shock. The body can respond in a couple of different ways to shock. Either it can respond in what's called a compensated fashion. This is called compensated shock. And that's when it utilizes mechanisms to auto-regulate blood pressure and the return of blood flow so that we return to a homeostatic set point. So, hemostasis is returned. That's basically in a nutshell what happens. So maybe let's say if blood pressure drops for some reason, maybe we can tell the arterioles to constrict, and that will elevate blood pressure back up to where it needs to be. Decompensated shock is the kind of shock you do not want to have, because decompensated shock means that a positive feedback loop has been set up, and rather than your body returning to a homeostatic set point, you are getting farther and farther into shock, and you're probably going to die if medical intervention doesn't come quickly. I'll give you an example. If somebody goes into, say, anaphylactic shock, the amount of blood circulating in the body obviously is dropping. That means the medulla oblongata, for example, suddenly is going to be deprived of oxygen. Remember, the medulla oblongata has that vasomotor center in it. If we deprive the medulla oblongata's vasomotor center of oxygen for too long, the cells in there will begin to die. When they begin to die, they no longer send a signal out to the body for the arterioles to constrict. And so now I even have massive systemic-wide vasodilation to add to my already existing problem, and my low venous return is going to worsen. And if this persists, obviously, I'm going to have so little blood flow, I actually die as a result. Another common disease involving blood vessels is one we've already talked about with the heart, so I don't really need to spend much time on it other than just to remind you of it, and that is the disease atherosclerosis. You'll remember that it principally involves damage to the tunica intima, or what's called the endothelium, and it involves the formation of these fat accumulations that eventually become very fibrous and can even accumulate calcium carbonate deposits in them. That's the development of what's called a fibrous plaque, like you see here in this picture. And remember, that can cause an occlusion or a narrowing of a blood vessel. Some plaques can even become unstable and break away, or they might rupture open. Either way, we might get some sort of a clot or embolus forming, and that can be quite dangerous. Some other types of circulatory disorders I'm going to mention just briefly. Peripheral vascular disease is basically the arms and legs version of CVD, or cardiovascular disease. It's basically having atherosclerosis in the blood vessels of the arms and legs rather than in the coronary arteries. But you can still get the same kinds of symptoms: the angina, the pain in the arms and legs. You can get occlusions, you can get thrombi or blood clots, you can get embolisms. All of the same kinds of problems apply. And they can treat this the same way they do coronary vascular disease, with the use of angioplasty and stents and blood thinners, etc. A dissecting aneurysm is a special type of aneurysm. Remember, an aneurysm is a bulging, if you will, of a blood vessel. Well, remember, there are three layers to a blood vessel: the tunica intima, the tunica media, and the tunica externa. If I get a splitting apart of two of these layers, if they pull apart from one another, the space that results can fill with blood. That's called a dissecting aneurysm. Okay, so when the tunics split apart from each other and blood accumulates in the space in between, that's a dissecting aneurysm. A fat embolism is when I have lipids enter into the blood. You get fat globules in the blood, and these can end up causing blockages in smaller vessels. Sometimes people, if they get, for example, a bone break, like their femur, the femur has a lot of bone marrow in the inside, and it has adipose tissue associated with that bone marrow. And sometimes the breaking of that femur can introduce fat globules in the blood and produce these fat embolisms. Aneurysms, as I said before, is just a swelling or bulging of a blood vessel due to weakening of the wall. And phlebitis, remember there's that ending itis, which means some sort of inflammation. Phlebitis is inflammation of a vein. Couple other disorders very quickly I'll mention. One is orthostatic hypotension. Hypotension, you'll remember, just means having a resting blood pressure that's lower than normal, something around 100/60 or lower than that. Orthostatic means that you have that hypotension when you stand up quickly, when you have a change in position. We often see this in elderly patients, and this is because their baroreceptors, those neurons that monitor blood pressure, become kind of sluggish in their old age. They slow down too. And so if an elderly individual stands up too quickly, the baroreceptors respond too slowly to the change in body orientation, and the blood begins to flow via gravity down into the feet and away from the brain, and this can cause dizziness, or what's called syncope, dizziness and fainting. Septal defects I mentioned previously with the heart. These are when, well, I didn't mention the septal defects, but I mentioned what's related to them. Remember I told you in embryonic and fetal development that we have these bypasses, for example, where the fossa ovalis is in adults, there used to be a hole in the fetus. If that hole doesn't seal over properly at the time of birth, it can create what's called a septal defect. Sometimes there'll even be holes between, say, the interventricular wall, the interventricular septum, or the interatrial septum, like you see here, and that produces what we call a septal defect. If they're not corrected, they can be fatal because what you're doing is you're mingling deoxygenated blood with oxygenated blood, and you're reducing the efficiency of your body's ability to deliver good oxygenated blood out to the tissues. Last one, very briefly, von Willebrand's disease. This is a deficiency of a clotting factor in the blood. It turns out to be clotting factor 8 if you're really interested. But the upshot of this is that the platelets are not able to bind to damaged endothelium when you have some sort of an extrinsic activator of blood clotting. And so the person's blood does not clot very readily, and you can get problems with severe gastrointestinal bleeding and other problems as well.